Hello and welcome to my presentation. My name is Marla. I'm currently working towards a psychology degree so I can pursue a career in marriage and family counseling. Psychology is the science of thought, emotion, and behavior. I've always been curious about human behavior, how people think, feel, act, and react. I believe that learning about ourselves and the people we come into contact with is critical to our growth and well-being. I'll be learning about factors affecting human behaviors and techniques for treating behavioral and psychological disorders. The academic journal I used in my article was the Families, Systems, and Health Journal of Collaborative Family Healthcare. This journal focuses on three domains: family functioning, systems thinking, and health. Their mission is to develop the knowledge base of a systemic approach to healthcare that integrates mind and body, individual and family, and communities, clinicians, and health systems while considering cost effectiveness and distributive justice. In the field of psychology, I found the articles to be precise, clear, concise, very professional and formal, use facts, evidence, and research to back up their statements. In my writing, I chose to be formal, but I did state some personal opinions in my writing. It was still clear and concise, and I used citations and research to support my claims. Munchausen syndrome by proxy is what I chose to write my article about. It's a factitious disorder and form of child abuse where the parent or caregiver of a child fabricates or induces illness in young children to gain sympathy and attention from medical staff, employees, family, and friends. Although elderly persons can become victims, children are at the highest risk, and especially children under age 5. A parent, babysitter, or caretaker of some sort either fake an illness upon the child or causes the child to become ill. Some of the examples of the illnesses these children display are vomiting, bloody stool, diarrhea from poisoning, seizures, apnea, and nausea. The journal articles of case studies on the Dynamed database and the Journal of Collaborative Family Healthcare, along with a few web articles written by professionals in the medical field, helped me to support claims in my research. A few of the authors that I chose were Georgia Pasqualone. She's a medical expert and forensic investigator. Dr. Richard D. Kinney, he's an active pediatrician. Deb Fulton, she's a current staff nurse. The main claim I'm trying to unravel in my article is how to identify Munchausen syndrome by proxy. The child that illness is being placed on must be constantly tested by medical staff, poked with needles, and in worst case have blood transfusions, are hospitalized, and sometimes even operated on multiple times because doctors and nurses are trying to find the root cause of the symptoms but can't. Each case is unique. In some cases that I've read, the minor child had serious illness like cancer or leukemia, while other children were reported to have minor but ongoing issues like asthma or seizures. Munchausen syndrome by proxy diagnosis can be difficult to diagnose. A common question is, how do these cases keep flying under the radar for so long? The patient's illnesses are persistent or recurrent and can't be explained. They have an atypical pattern. They don't respond to usual treatments. Lab findings are not consistent with the child's medical history, or there's a conflict with their normally healthy appearance. Treatment for the child, once diagnosed, would be to immediately remove the child from danger and from the abuser, treat the child for any poisoning, and provide counseling for the child for the damage that the abuser has done to them. Counseling for the abuser, so far, they would face criminal charges if they were confronted or confessed, and there is psychiatric counseling available for them to assist in dealing with the issues that led them to abuse their child. Once it's discovered that the parent is abusing the child, they must be protected and placed in a safe home, receive treatment, and do counseling. Unfortunately, sometimes the only way Munchausen syndrome by proxy is diagnosed when the child dies, or the police arrest the caretaker, or the victim becomes too old and the risk of them realizing what's happening to them makes the caretaker select a new victim. There isn't much treatment available. This is where I would call you to pay attention and be aware of things that you've seen or things that you may see at the hospital or at schools or in the grocery stores or wherever you are. If you have friends that have children that seem to always be sickly, pay attention, get the police involved, a school counselor, get someone involved. We all need to stick together and find out the best way to protect the child that's in danger and to get counseling for the abuser. That's the end of this presentation. Thanks for listening.